Did you know that the main factor of blindness in humans is a disease called diabetic retinopathy? However, this disease is largely prevented by incorporating holistic and medical interventions. Diabetic retinopathy develops in nearly 27% of the population globally. Recent data shows that many young people are developing diabetes worldwide, and most of them are showing signs of early onset diabetic complications. Hello everyone, I'm Vivian Benjamin. I'm a registered nurse, registered nutritionist, and the founder of Nutrition Takes. Today, in Nutrition Takes video channel, I'm going to talk to you about diabetes-related eye disease, a guide to eye health. So let's talk about diabetes. Do you know what is diabetes? Diabetes is predominantly one of the major non-communicable diseases affecting millions around the world. Non-communicable disease is an illness that is caused by unhealthy lifestyles and behaviors. So examples of non-communicable diseases are cardiovascular disease, diabetes, cancer, respiratory disease, and many more. According to data from the Centers for Disease Control and Prevention, non-communicable disease kills at least 41 million people each year. Diabetes is a metabolic disease defined by the increase in the level of glucose in the blood, hyperglycemia, due to the defects in insulin secretion, the hormone that's produced by the pancreas, and or insulin action or both. So when you consume food, the body breaks it down to sugar or glucose and releases it into the bloodstream. Insulin is then released to control the level of glucose in your body. Do you know how many types of diabetes are there? Well, there are 3 types of diabetes: type 1 diabetes, type 2 diabetes, and gestational diabetes. In type 1 diabetes, the insulin-producing pancreatic beta cells are destroyed by an autoimmune process. The body attacks itself by mistake. As a result, your body produces little or no insulin. Type 2 diabetes is impaired beta cell functioning, resulting in reduced insulin production and decreased insulin sensitivity. Gestational diabetes happens during pregnancy, and the unborn baby has a higher risk to develop health problems. It usually goes away after the baby is born. So what are the risk factors of diabetes? The first one would be family history. So if your grandmother or grandfather have diabetes, you may have a higher chance of getting diabetes yourself. The second risk factor would be obesity. The third, hypertension, high level of cholesterol, sedentary lifestyle, and poor diet are all the risk factors for diabetes. So what are the symptoms for diabetes? Number 1, you will have an increased appetite or polyphagia. You can also have increased thirst or polydipsia, or increased urination, polyuria. There are other symptoms that can affect you if you have diabetes, which are tingling or numbness in hands or feet, fatigue, vision changes, wounds slow to heal, dry skin, and recurrent infections. So what are the complications of diabetes? There are lots of complications of diabetes, but what I'm going to highlight in this video is diabetic foot, diabetic retinopathy, diabetic neuropathy affects your kidney, diabetic nephropathy, which affects your nerve. So now that you know a little bit about diabetes, what are the risk factors for diabetes, the symptoms of diabetes, and the complications of diabetes, I'm going to share to you about diabetic retinopathy. So what is diabetic retinopathy? Diabetic retinopathy is one of the primary and progressive complications of diabetes. It is caused by changes in the small blood vessels in the retina, the area of the eye that receives images and sends information to the brain. Patients generally have no symptoms at the early onset of this disease. Nevertheless, symptoms start to emerge as the disease progresses. Patients start to notice symptoms such as blurred vision, floaters, and distortion. Sometimes the capability to see the world's beauty can be taken for granted. The eye is a sensitive organ susceptible to various disorders, predominantly impaired vision. Damaged vision affects us greatly in our everyday life. It limits your independence, safety, self-esteem, work, and lifestyle choices. Unlike most organs in your body, the anatomy of the eye can be easily assessed for examination. The eyeball is situated in a protective bony structure called the orbit. It is surrounded by connective tissue, adipose tissue, and muscles. Annual checks are recommended to nurture your eye health. Common eye problems are low vision, blindness, conjunctivitis, cataract, glaucoma, diabetic retinopathy, and age-related macular degeneration. Eye disorders stem from different causes. However, commonly it is caused by age, chronic disease, nutritional deficiency, poor lifestyles, and trauma. I would like to walk you through how diabetes and eye health are associated with each other. And I would also like to talk about how you can support your eyes from the inside and outside. So now that you know about diabetes and how diabetic retinopathy affects your eye health, I'm going to share with you some guide on how you can cultivate healthy eyes from the inside. Nutrition. Nutrition is the chief principle in sustaining your body from the inside. Consuming various vitamins and minerals in your daily diet can help care for your eyes. Apart from that, adding the three main macronutrients, which are the carbohydrates, healthy fats, and protein, are also essential in overall eye health. Eating a balanced and diverse kind of food is the key to long-lasting health and well-being. So what are the examples of nutrients to sustain eye health? Zeaxanthin and lutein. Zeaxanthin and lutein are both a type of carotenoids found in food. These carotenoids are the ones that give the food the yellow and red colors. Antioxidants are significant in your bodies, and zeaxanthin and lutein is a type of antioxidant. It helps protect you from things that damage your cells and free radicals. Zeaxanthin and lutein both exist in your body and naturally protect you against the light. It absorbs fat similar to fat-soluble vitamins, so make sure you have some good fats when you incorporate zeaxanthin and lutein in your daily diet. Vitamins A and E are fat-soluble vitamins that are best for eye health. When you add food containing these vitamins, ensure you add some good fats. Vitamin C helps protect your cells from free radicals. It is essential for the growth and development of cells. Essential fatty acids. Omega-3 fatty acids are significant for visual development and retinal function. Zinc. This trace mineral plays a key role in transporting vitamin A from the liver to the retina to produce melanin. So there are other methods you can improve your eye health from the outside, which are exercising, having good sleep, managing stress, thinking positive, lose weight, and controlling your blood sugar. There are some additional guidelines that you can practice to cultivate healthy eyes. Tip number 1. Don't sit in front of the television or computer for a long time. The light from these electronic appliances can harm your eyes. Also, refrain from watching movies with the lights off. Wear goggles when you are dealing with a harmful substance that may irritate the eyes. Wear sunglasses to avoid exposure to the sun. This is all due to your eyes being a very sensitive organ. If you are wearing contact lenses, make sure you clean them properly and throw away old eye makeups. Don't touch your eyes with dirty hands, and do take care if you are in a place that has a high record of air pollution. And last but not least, go for an annual eye checkup.